Welcome back to the channel where medical topics are made simple. Today you will learn a simple memory trick mnemonic to help you remember the causes of shortness of breath. Make sure to share this video with your friends and colleagues so they can learn this memory trick too. And real quick, you can find all of these topics in our Teach Me Medicine book. If you don't have the book yet, it'll be linked down below. The mnemonic to remember is breathe. You're going to use the word breathe to remember the causes of shortness of breath. This is perfect because breathe makes sense with shortness of breath. So each letter will stand for a cause of shortness of breath. Starting with B, this will help you think of bacterial causes, and this may include pneumonia. It may also include bacterial endocarditis, which is inflammation of the heart from an infection. And remember, if the infection involves the right side of the heart, then the infection can spread into the lungs called septic pulmonary emboli, and this could make the shortness of breath even worse. The R will help you think of reactive airway disease. Now, reactive airway disease is a general term to describe asthma-like symptoms, but it works for the purpose of the mnemonic to help you remember asthma and obstructive lung disease. These are conditions that cause the airways to narrow and are typically associated with wheezing, bronchoconstriction, and bronchospasm, and this could include things like COPD, asthma, bronchiolitis, and bronchitis, to name a few. You can also use the R to help you remember restrictive lung disease. So we have obstructive lung disease, which are diseases that narrow the airways, and we also have restrictive lung disease, which are diseases that make it difficult for the lungs to inflate. And this will include conditions such as neuromuscular disorders, interstitial lung disease, and obesity, to name a few. Next is the E, and you can use this to help you think of embolism. This will help you remember a pulmonary embolism, which is when a substance like a blood clot travels to an artery in the lung and blocks it. Moving on to A, this will help you remember acute coronary syndrome, which are conditions associated with decreased blood flow to the heart, and this includes unstable angina, along with NSTEMI and STEMI, which are heart attacks. So it's important to remember cardiac causes can lead to shortness of breath too. Also included with the A is airway obstruction. It's a general term that will help you remember any type of airway obstruction. This could include a foreign body, aspiration, angioedema, or anaphylaxis, to name a few. Airway obstruction includes a lot of different conditions, but if you notice, angioedema, anaphylaxis, and aspiration all start with A, so this will help you remember the A as well. Now let's move on to the T. This will help you remember a couple different conditions: tension pneumothorax and tamponade. A pneumothorax is sometimes referred to as a collapsed lung. More formally, it's an abnormal collection of air in the pleural space between the lungs and chest wall. A tension pneumothorax is a type of pneumothorax. It's when air enters the pleural space but can't move out. The trapped air causes increased pressure in the pleural space, and it can lead to tracheal deviation, decreased venous return, and more. But for the purpose of the mnemonic, the tension pneumothorax is there to help you remember pneumothorax in general. And then we have tamponade. This will help you think of both cardiac tamponade and pericardial effusion. Remember, a pericardial effusion is when fluid builds up in the pericardial space around the heart, and then tamponade physiology occurs when that fluid builds up so much that it puts pressure on the heart and disrupts the normal pumping function of the heart, and this can decrease cardiac output. This is a type of obstructive shock. Of note, both pulmonary embolism and a tension pneumothorax are also types of obstructive shock. Moving on to the H, this will help you remember heart failure, which is when the heart is unable to pump enough blood to meet the body's requirements. Finally, we have the other E. This stands for electrical excitation. This will help you think of arrhythmia, which is an abnormal heart rate or rhythm, and this could include things like atrial fibrillation, atrial flutter, supraventricular tachycardia, bradycardia, and ventricular tachycardia, to name a few. E can also stand for edema. This will help you think of pulmonary edema, which is fluid buildup in the lungs. And finally, the E can stand for effusion, which will help you think of pleural effusion, or fluid buildup in the pleural space around the lung. So you can see how this is a great mnemonic to remember some of the main causes of shortness of breath. A few reminders: this mnemonic focuses on the thorax, mainly problems with the lungs and heart, and it also focuses on conditions that are more urgent. This is not an extensive list, and there are conditions outside of the thorax and other less severe conditions that can also lead to shortness of breath. But this mnemonic is useful to help you remember some of the main causes. If you found the memory trick useful, please hit that like button and leave a comment. Subscribe to save time studying and not miss out on future videos and notes. You can find all of our flashcards, notes for the videos, and book linked down below. Thanks for watching, and hope you return for future videos.